biggest emergencies in the whole world, and that's this corona, right? So it's very urgent that we understand what all needs to be done, right? What we are going to talk about is the traditional medical emergencies that happen. Okay. Okay. So what is an emergency? An emergency is a unexpected or dangerous happening or situation, right? It never comes telling. An emergency never comes telling unless you want it to come by not being prepared for it. Okay. So you need to be prepared for the medical emergency so that they don't happen. And this is exactly what we are going to talk about. We are going to do it in two parts, right? So the first part will be basics, and then we'll be talking about respiratory and the cardiac emergencies in the next lecture. Okay. So the outline of this lecture, as I said, would be to identify what are medical emergencies, what is the physical status, what are the different types of medical emergencies, general principle, and the definitive management, right? So what is the background? So the background is, like we feel that sometimes medical emergencies don't happen, right? They are more they would happen to somebody else, right? But that is not the case, right? The dentists are expected to take care of the patients who would be able to provide life-saving treatment on the dental chair. There are so many instances where you see that there is loss of life on a dental chair, which is one of the worst things that could happen. Okay, so this should not happen, and we should be able to take care. We have to provide holistic care. That is the main thing for which I'm going to lay stress on, right? The DCI also says that you have to treat the welfare of the patient as paramount to all other considerations and conserve it to the utmost of its ability. That means we are not just looking at the tooth, right? We are looking at how to give holistic care, and maybe if the need arises, we have to take care of the patient accordingly, right? So the first thing is we sit relaxed saying that it could never happen to me. And this is exactly what happened in this corona period also, because we thought that this is happening in China and some parts of Italy, right? We never thought that it's going to affect us, but then it has in a big way, right? What is most important is patient safety, right? Professional standards. You are something that the society looks forward to, right? Even dentists are in many countries have been trained to take care of the COVID patients, and if need arises, we may also need to extend a help for that, right? The professional image, right? We are not just, ki daant mein chandi bhar diya, this was the kind of image that people had. But now we have to go beyond that, and we have to improve our professional image, right? So this is something that is extremely important, right? And the duty of care. So like a bolt of lightning which can strike anywhere, emergencies can also happen in any dental setup if there is a problem, something that happens. And why does it happen? It happens because there are certain risk factors which are increasing. Now, what happens is basically the longevity of the patients has increased. In the initial, in 60s, 70s and all, if you live up to 60, that was considered to be great. That is why there was that big celebration of 60th birthday. But now what has happened is that with the advent of various procedures, surgical procedures, medicinal treatment, the age of the longevity has increased. If a patient has got a cardiac arrest, there are angioplasties, bypass surgeries that are done to ensure that the patient lives longer, right? There are medical advances in so many fields. Right? Medical includes surgical also, brain tumors are operated with robotic surgery, so on and so forth. Drug therapy, the patient who has got, you know, like I said, a cardiac arrest or some other medical emergency, you give drugs and you revive the patient. Increased number of surgical procedures. If we, those who are keen on implants would see that there are so many implant procedures that keep happening in a big way. There are many implants that have been put. There are zygoma implants, which are quite extensive. So this takes a toll ultimately on the patient's health. Longer appointments, obviously, because we are working on patients, multiple root canals, multiple extractions, implants being placed at the same time. This leads to an increased use of local anesthesia, analgesics, antibiotics, and sedatives. They all interact with each other and they cause a lot of problem later on, right? So we have to be sure as to what we are dealing with, and we have to make sure that we maintain our professional image, which is very important. You should be proud. People should be proud of you, saying that, you are the dentist or the doctor who takes very good care. And, we cannot advertise by ethics. We cannot advertise. So it is the publicity of, by the word of mouth, that leads to this particular thing. Okay. To promote a culture of patient safety among the dental team, dentistry is never single-handed. It is always more or less minimum of 4 hands. So we should inculcate a culture of patient safety, right? Greater emphasis on teamwork, and it is extremely important in now with Corona that we work very, in tandem, so that the patients are very well taken care of. And the satisfaction of possessing life-saving skills. Like, we have the clinical skill lab in the medical college where we train the students, the interns, and the doctors to for basic life support, for having that skill, and then you can get that satisfaction of saving a life. Okay. Now, what are the most common medical emergencies in dental practice? The first one is unconsciousness. The basic type is unconsciousness, which includes vasodepressive syncope, orthostatic hypotension, acute adrenal insufficiency because of lack of adrenaline, right? Corticosteroids, right? Then altered consciousness. This includes diabetes mellitus, thyroid dysfunction, and cardiovascular episodes. That is the stroke. Then you have seizures, okay, toxicity, which results because of toxicity, hypersensitivity, ischemic heart disease. Then in ischemic heart disease, you got angina and myocardial infarction. Now, myocardial infarction is something that results because of permanent damage to the cardiac wall. There is somebody who's got the audio on. Somebody's kept the audio on. I think it is Rishikesh Mishra, I'm not very sure, but looks like that, right? Please switch off your audio. Then respiratory distress, where there is airway obstruction, hyperventilation, and asthma, and heart failure and pulmonary edema, right? So we'll deal with them as we come to it, okay? Now, the risk assessment is very important. That is why history is very important, which has been told to you, okay? So when we are talking about risk assessment, the American Society of Anesthesiologists has classified the physical status of a patient as PS1, that is normal or healthy patient. That is physical status 1. Then you got PS2, PS3, PS4, what you can see on the screen, and PS5. Now, if you look at this PS5, now PS5 is somebody who's not going to survive for 24 hours. So this is some patient, obviously, who's not going to have any dental treatment, okay? Maybe a case of a severe cerebral hemorrhage, or a patient who's got a major cardiac arrest. So these are patients who are not going to survive for long, right? So what is the best is this patient who will come to us, but unfortunately with lifestyle diseases happening, we get normally PS2 and PS3, which is more common, okay? Patients with hypertension, patients with diabetes, cardiac compromised patients. So these are the ones which we usually come across. Okay. So what happens is that we have to ensure that everybody is well taken care of. Now, stress is something that we cannot, do away with in our own life. Right now, we'll be stressed कि क्या होगा कोरोना के बाद, कैसा होगा, how is lifestyle going to happen, when will I get to see a movie, right? These are all things that happen. Now, if there is stress, you know what happens usually is that there is an increased load to the heart. Okay, the heart rate increases, the strength of myocardial contraction it increases, and this ultimately this leads to a increased oxygen requirement. Okay, so it's imperative that all this stress gets is seen to be reduced in our clinic. Okay, so like I said, PS1 can tolerate, but PS2, 3, 4 are less able to tolerate this stress. So we have to be very careful. So a patient who's got an angina may develop chest pain or dysarrhythmias, right? Heart failure can go into pulmonary edema, asthma can develop into acute respiratory distress, and epilepsy may develop seizures. Hyperventilation and syncope may develop in PS1. Now, syncope is something that, I'll deal with it. It's just fainting, okay? Now, fainting happens because of so many reasons, and I'll deal with it. So, PS1, which is the safest patient, can develop this because of fear of dental treatment, okay? So, what is unconsciousness? Unconsciousness can be because of a lot of causes which we'll deal. Now, what is most important is that the patient positioning is extremely important. Okay. Now, this is the position which in every patient of unconsciousness has to be dealt with. Okay. The head, the thorax, and the leg should be in one plane. A lot of books will mention that you have to keep the head low, but that is not correct. You have to keep the patient in one plane. If the patient has got syncope, you have to raise the legs. That's all. Okay. Never you should keep the patient in a Trendelenburg or head low position. Number 2, to prevent the tongue from falling back, what we need to do is we need to do a jaw thrust chin lift procedure so that the tongue does not fall back. So this is a simple thing where you keep your fingers behind the mandible, angle of the mandible, and just pull it forward so that the airway patency is maintained. All right. So what is the basic algorithm? Recognize unconsciousness. You should call and see. Always make sure that you have somebody moving around, your assistant or your attendant, right? It's also important that we know the patient's name. Imagine in the oral surgery OPD, there are 10 to 12 patients, and then suddenly you shout out AA. So all the 15 patients would be looking at you except your own patient. So it is important that we know the patient name. So you can say, Suresh, tumko theek lag raha hai kya kar? Right? So this is very important. You have to discontinue the procedure. You have to activate the emergency team, right? Position the patient, assess breathing, and you have to palpate the carotid. That is the best way of palpating the arterial pulsations, and you have to maintain circulation. That is very important. Okay. So it's imperative that you keep this algorithm in mind, right? And you have to, and then ultimately, whatever the cause of unconsciousness, you have to provide the definitive management. So the first thing in unconsciousness is syncope. Actually, it's pronounced as syncope. Okay. So syncope is, there are different causes of syncope. The most common cause of syncope in dentistry is fear, right? If you look at the dental instruments, all of them are sharp. Okay. Now, when they are sharp, right, and you brandish them in front of the patient, then it becomes, the patient feels that you're going to stab him or her. Okay. So you have to be very sure that you pass the instruments from the back of the patient and don't use it, like you're holding a stabbing knife or something in front of the patient. Okay. So fright you have to eliminate, anxiety you have to calm the patient. If you have a patient who needs an extensive surgery, try to schedule that patient early. The patient should not be kept waiting, because as the patient is kept waiting, the level of endogenous cortisol increases and the patient can be prone for lot of anxiety and panic attacks. Okay. Then you have emotional stress. Okay. When you have emotional stress, that is also a thing where you should try to reschedule the patient. You know, patient has had some bad news. Okay. That corona, which was corona lockdown, which was supposed to end on 21st of April, has got extended till 3rd of May. You know, things like that. Okay. So again, unwelcome news, right? So these are things which you have to be very sure of when you deal. Now, the sight of blood. I have seen so many third year students who faint during the first posting when they see an extraction happening. Okay. So rather than the patient fainting, the doctor faints. So we have to be strong, right? The same thing for the patient, right? So you should not make sure that, you know, there's a lot of blood collected in the oral cavity. You should do frequent suctioning. Okay. Extensive surgical procedures, schedule the patient in such a way that you are able to do it in a calm situation. You can play some soft music, right? And like I said earlier, instruments is something that you have to deal with very carefully and nicely. Okay. You should never wave the instrument in front of the patient, right? Then there are non-psychogenic causes, standing erect, and when you keep standing, then what happens is that there is a chance that the patient will get fatigued and will fall down. Now, this is what happens in a lot of parades, because those policemen, they have to keep standing for a long time, and then they suddenly faint, and they might fracture their mandible, okay, and the mandibular condyles. Okay. Now, hunger from dieting. Okay, that's something that happens. So one should not keep hungry for a long time. You should keep eating. Okay, not to put on weight, of course. Then the male gender. Now this will make a lot of ladies happy, because you know what happens is that the men, they try to show that they are strong, but ultimately when one comes to a dentist, sabki hawa nikal jati hai. So what happens is that you feel that whenever you are frightened, the first reaction is to run away, fight or flight, right? So you cannot fight a dentist, so you try to run away. That is also not possible. So when you're sitting in a dental chair, there is pooling of blood in the peripheries, that is the lower limbs, and that way the brain gets deprived of the vital oxygen, because the blood has got stagnated in the peripheries. So that is why males are more prone for having this syncopal attacks rather than females, because ladies would, you know, rather be nahi humko to dar lagta hai, so it's okay, so they are able to deal with it better, right? The age of 16 to 35, that is also a usual thing, you know, like one tries to show that they are brave, but then they are not. Okay, so that is another reason. Okay, so you have to be very calm and collected, schedule the patient in a good way, a nice way, have some soft music playing. Poor physical condition, those who are not well should be referred to a physician for the consult. Exhaustion, obviously one who has got a very rough day, then that patient would find it difficult to maintain his normal energy for the whole dental procedure. Hot, humid, crowded environment. Now, a Mumbai local with 150 passengers in one coach, we find it hot and humid and crowded. But the same thing, if we go for a concert, then obviously we enjoy that. So it's all a matter of perception. But anyway, India is a hot, humid country, so we cannot escape it. So you should see that, you should ensure that there is even social distancing when you keep your patient appointments. Okay. So the patient should be energetic when the patient comes to you. Okay. So you can do, you know, those patients who need surgery and all, they can be posted earlier. Those patients who need veneers or crown cutting, they can be posted towards the end of the day, right? So the pathophysiology is, like I said, it's pooling of blood because of the fear. So that is the pre-syncopal phase, right? In syncopal phase, obviously there is no blood supply to the brain. It gets ischemia, right? And the patient faints. And then after that, when you manage the patient recovers. And this is what you see, okay? So you have to be very careful and, We have to deal with these patients in the best possible way, not to have, do such things. Agar syringe में से हवा air निकालनी है, to do it at the back of the patient. You push the piston of the syringe only in Hindi movies, right? Don't do it in actual practice in front of the patient. So this is, like I said, the patient is in one plane. This ensures that there is proper blood supply which gets restored, right? And then you can raise the legs. When you raise the legs or you tell the patient to move the limbs, the patient's, the muscular action will push the venous blood towards the heart and ultimately to the brain. So we assess consciousness. We have to discontinue procedure just because the patient has got fainted. Doesn't mean that you should go ahead and do the procedure. Activate the emergency team, position the patient properly, and maintain. You assess the breathing, palpate the carotid, and maintain circulation. Definitive management. If the patient fails, then you have to give supplemental oxygen. Keep the vital signs observable. Nowadays you get a small finger probe, a pulse oximeter that can be easily put, and you can monitor the patient's oxygen saturation as well as the pulse rate. If the patient fails, if the patient's pulse rate has not improved, then you can administer atropine, which is 0.6 milligrams per ml, right? So that should be in your emergency kit, which I'll be dealing in the next lecture, right? Altered metabolism. Now, this is a condition where you got diabetes mellitus, and this is sometimes it becomes very dangerous, especially when you're dealing with hypoglycemia, okay? So in hypoglycemia, one has to be very careful. But before we go to hypoglycemia, let's talk about a scenario where there is increased, glucose in the blood, right? So what happens is that there is increased blood sugar. Now, this is one of the two life-threatening complications diabetes, right? But not as serious as hypoglycemia. It is slow to develop, but if not treated, can result in diabetic coma and death. Okay, but hypoglycemia, on the other hand, is very rapidly developing, and that deprives the brain of the vital substrate, that is the metabolite that the brain uses, and that is glucose. Okay, so in hyperglycemia, there is deep labored respiration. There's a sweet fruity odor. You must have learned it in medicine, right? This is because of ketoacidosis that has set in. Now, the skin would be dry and warm in hyperglycemia. It is cool and moist in hypoglycemia. Okay. The pulse rate is weak, right? The patient feels thirsty. The patient feels disoriented, and the patient could have headache. Okay. So the next and the most important thing is hypoglycemia. Now, hypoglycemia is a very, very potentially life-threatening condition. It's where there is acutely decreased blood sugar, right? So this, like I said, it's pretty dangerous. Okay. Administration of glucose is indicated, right? Now, there could be a scenario where you fail to recognize hyper or hypoglycemia. If you give the patient glucose or, dextrose, as it is medically called, right? If the patient revives, then obviously you are dealing with hypoglycemia. If the patient does not revive, then there is a chance that it is hyperglycemia, and then we can refer the patient to a medical center, and the physician would, give the patient insulin and restore the normal blood supply. So the patient would be hungry, there is nausea, the patient is irritable, there is confusion, right? And the patient will show bizarre behavior. So altered consciousness, you have to discontinue. Emergency team. PABCD is very important, right? There is somebody who is joining now. Very good. So better late than never. And then institute definitive management. Medical, you should get medical advice. Administer 50% dextrose. Monitor vitals and administer oxygen if needed. Okay. Now we come to respiratory distress. Now what happens here is that there are different levels at which it can happen. The emergencies can happen at the cerebral level, at the laryngeal level where there is an acute airway obstruction, or there could be bronchial asthma over here or some lung disease. We would be basically concentrating over here because this is what happens, right, in a dental clinic, and I'll deal with it. Okay. So what happens is that the asthma is a group of illnesses producing irreversible hyperactivity of the large and small airways, right? There is triggering factors including pollen, stress, cold, upper respiratory tract infection, exercise, animal fur, and medications. Okay. So we Indians normally do not have allergy as compared to the Western world, but of course that's not to say that it doesn't happen. Okay. So what are the different features of asthma? There is wheezing. Okay. There is shortness of breath. There is coughing because the patient tries to, it is more of an expiratory problem than an inspiratory thing, right? There is sputum production, the use of accessory muscles for breathing, right? Now which are the accessory muscles? You have the ala nasi, right? Okay. And you have the neck muscles where the patient tries to use them, okay? There is tachycardia because the tissues need more oxygen, so the heart pumps faster, despite the fact that there is less blood supply available, less oxygen supply available, right? So the objective is to improve ventilation by reducing or eliminating bronchospasm, okay? Removal of the allergens, okay? Now, what is basically used is the patient, a known patient would get his inhaler, right? Or something that the patient is taking. If the patient is incidentally found to be asthmatic, then you need to have certain drugs such as Dedifilin in your emergency kit. Okay. So the patient who is scheduled for dental surgery should always be advised to take his inhalant, right? Monitor the vital signs, oxygen supplementation if needed, right? You cannot say that I don't have oxygen in my dental office. You need to have it, okay? And assess the need for medical treatment. So as far as possible, you should always ensure that you have the medical physician or a hospital number on the speed dial, okay? So what are the signs? You have to identify whether the patient is having asthma, okay? Breathing, carotid palpation and circulation, and then you have to reduce the patient anxiety and you have to reduce the distress. Now, what is the definitive management? Like I said, you need to make the patient carry the inhaler. Otherwise, you need to have something called as Dedifilin in your emergency kit, which you'll have to inject the patient. Okay, that we'll see later. So airway obstruction, I think we are coming to the end of the first half of this particular lecture. So airway obstruction, it can happen while it's unlikely to occur while being treated. Having said that, there have been studies where, the denture gets lodged, or sometimes the root canal file can go in, or a tooth goes in while extraction. So these are all things you have to make sure that it doesn't happen. Okay. If it goes into the digestive tract, it's okay. But if it goes into the airway, it is an acute emergency, right? And if you're fortunate, if it's in the upper airway, the patient will usually cough it out. If it goes into the lower airway, it is more a problem, right? Because then you cannot retrieve it because you have the larynx and the vocal cord. So you have to get somebody to do a bronchoscopy to retrieve it. Okay. So, and it can cause loss of consciousness and cardiac arrest, because once you are preventing oxygen from entering, obviously the patient is going to have a cardiac arrest very soon. Okay. So you have to diagnose between complete and partial, right? So in partial, what happens is that the patient keeps coughing and making, croupy noises, right? If it is complete, the patient will obviously not be able to make any phonation, but will show a signal that there is something that is obstructing. Usually, though it is not taught, but this is the usual sign where the patient will show that, the patient is gasping or choking. Okay. So it's very important. So choking, gagging, violent inspiratory effort, the patient will have a flushed face because obviously all the muscles of accessory muscles of respiration are working, and there is more blood supply which is going there. There's extreme anxiety. If the patient gets disturbed, there is cyanosis because of the blood supply being gradually cut off, and hopefully it should not lead to this stage. Okay. So you immediately check for breathing. Don't waste time, not more than 10 seconds, right? This is an emergency, and then you can ensure that you can do a jaw thrust chin lift procedure, right? If you do not have a Magill's forceps in your dental clinic, you can just make the patient go in a lateral decubitus position, right? And if the patient, suppose there's choking that happens in a restaurant or a place, it need not be a dental setup at all, and the patient suddenly chokes because somebody eating some non-veg food, there can be a bone that gets lodged inside. So you are a medical professional, so it is expected from you to do something to save the patient, right? So put the patient in lateral decubitus position, elicit cough reflex. If the foreign body is retrieved, get a medical consult to ensure that there is nothing. If the foreign body is not retrieved, send the patient to a medical facility to get a CT scan or a chest X-ray done, right? And then ultimately you have to do a bronchoscopy. Now there is something called as a Heimlich maneuver, right? Which we'll talk about in just a while. So there are different methods of doing it. So a back blow, a manual thrust, an abdominal thrust, a chest thrust, right? Now, this is one of our students who had offered himself as a volunteer for this photograph. So if you see, the rescuer is standing, this is the Heimlich maneuver. The rescuer is standing behind the patient. The fist of the non-dominant hand is kept like this, right? And you have the palm, which will push the fist inside, okay? So this is the fist and this is the palm. This will be put in the xiphoid process and then given a inward thrust, okay? So that is what is Heimlich maneuver. So what it does is that it creates a positive pressure here and the object is going to fly off from the lower respiratory tract, okay? So this is the importance of a Heimlich maneuver, right? You should not use too much force, right? This is just a joke, right? So you should not use too much force, but then you should be aware of all these procedures. Maybe when things improve, we'll show you all these things, how to do it, okay, on mannequins also, right? So I think that finishes today's half of the lecture. And from next time, we're going to deal with a few more airway emergencies and cardiac emergencies. So if you have any question, please let me know, right? So do you have any, I'll just unmute everybody. Or you can unmute yourself if you have some questions, right? Okay. So I request the CR to send me the attendance, right?
Yes.
Yeah. So thank you so much. So we meet on next Monday, if not earlier, right? Okay.